So last week I was standing with students in the wards and we were actually discussing quite a number of patients that we have in the ward. And some of them were actually having community-acquired pneumonia, which for some of us is easy to understand, and we think there's an easy approach to the management of that. However, upon closer inspection, we actually found that these two patients, both with community-acquired pneumonia, actually needed to be treated differently. The one we were able to change from IV to PO, and the other one had to stay on an IV med just because of severe nausea, vomiting, and she also developed some diarrhea, which then resulted in the question, well, why the diarrhea? And she was previously admitted on a course of antibiotics, coamoxiclav, and so we spoke to the medical team and discovered she actually has C. diff. So that is what we actually do with our students in their 4th year. I'm a practicing pharmacist as well as an academic going on weekly ward rounds with our students where we apply the principles that we taught them from 1st to 3rd year. So how do we actually get them to that point? So I want to start off by just explaining a few things about our Service Learning in Pharmacy program. Now, Service Learning in Pharmacy program already starts in their 1st year and it continues in their 4th year where we actually call it something else. As you can see, there's the patient care experience. And that is a 10-week rotation, 5 consecutive days. So our students are not on campus in the last 10 weeks of the 2nd semester. They're basically out in the hospitals. So in our SLIP 1, our Service Learning in Pharmacy 1, our students have 3 visits to community health settings. In SLIP 2, it's 6 visits in the year where they work at nurse-driven clinics. So there's no pharmacist, no doctor. And we teach them on campus some principles about TB, cardiovascular diseases, which they then go and apply. And we follow the approach of interprofessional teaching and learning because we rely on the nursing staff to teach our students some key skills. In SLIP 3, our students have 2 visits of a week each where they go full-time to clinics where there's doctors, there's pharmacists, they might have a dietitian there, and they've got some certain objectives that they need to achieve there. It's more focused on pharmacy-related things like dispensing, pre-packing, but they also get the opportunity to join doctors in consultations with patients. And then in the 4th year is where they actually spend 10 consecutive weeks in tertiary or district level hospitals. As you can see on your left-hand side, we have 10 hospitals where our students work in. We've got 28 community health centers and then also 22 primary clinics where these students go and work in. We still believe that the core is the basic pharmacology, pharmacy practice, pharmaceutics, pharmaceutical chemistry. I'm not going to go into the details of the things that they actually teach the students about the basic pharmacology, kinetics, microbiology. All of those things happen from 1st to 3rd year. But something that we brought in our 2nd year in their 1st semester already is a course that we just call therapeutics. We have therapeutics 1 to 3. So in the 2nd, 3rd, and 4th year, where we do intensive training on therapeutics. To give you an idea of what we cover in therapeutics, that is just an overview. There's far more going in there. At this stage, I've highlighted in red where we actually focus on antimicrobial stewardship. In the 2nd year, 1st term, we do a lot on preventative health, rational medicine use, pharmaceutical care. As previous people have also indicated, students need to know the history and the philosophy of pharmaceutical care, and then when they see me, I take them for 6 weeks through pharmaceutical care in a practice environment. We do dermatology, respiratory diseases, as you can see, and then in term 4, in the 2nd year, we do infectious diseases 1. That is where we introduce to them TB, we introduce HIV. They don't know the pharmacology drugs, but we want them to understand the disease and the global burden of that diseases. We also introduce the terminology, like what is MIC. We introduce to them various things like time-dependent killing. We talk about virulence. So all the microbiology things we just re-emphasize again. In their third year, we spend time on evidence-based medicine, giving them the tools and the skills so that they could actually read an article and start appraising those articles. And then we have a 6-hour course on antimicrobial stewardship, where we take them through why antimicrobial stewardship, how the team of an antimicrobial stewardship team should look like, and then we give them case examples on how to actually apply those skills in antimicrobial stewardship. Then we also have infectious diseases too. That's where we do our meningitis, our pneumonias, we do our soft skin and tissue infections. And all of these therapeutics happen with lectures during the week, and then on Mondays they have their paper-based case labs, where they actually need to prepare in advance these patients and then be able to come up with a therapeutic plan. And then in fourth year, we do pharmacovigilance, and like I've explained to you, they have their 10-week rotation where they are part of the multidisciplinary team, where they round with Prof. Mark Mendelson, Tom Boyles, and they're actually involved in antimicrobial stewardship. They also have to prepare various cases on patients that they see and apply those principles of AMS. And then lastly, these are some of the resources that we use. They are available online. We do require our fourth-year students to actually complete the SASP online course as part of getting their credits for that 10-week rotation. I also use Twitter, where I engage with students to also follow people that are strong in antimicrobial stewardship, like Angelique, Michelle, and Adrian Brink in the audience. And then definitely they get involved in all the campaigns right through the year, national campaigns as well as global campaigns. Thank you.